Top of the hour across the state of Alabama on Daybreak Live on Spectrum Cable. I'm Jimmy Dale Abrams. Thank you so much again for joining us. And we're partnering this morning with Coosa Valley Medical Center Wound Care Department. And Quincy Leach is joining us this morning. Quincy, good morning.
Good morning, sir.
And you have brought beauty to the set this morning. Introduce.
Yeah, I figured TV land would need that with me on here, but this is Bethany Sisk, and she is the program director for our local wound care center. And Bethany does a lot of different things from our center to help with patient coordination and volumes and helping us get all of the things that we need to make sure that we provide the best wound care to our community possible.
Absolutely. Bethany, welcome.
Welcome. Thank you.
Good to have you with us this morning. Tell us a little bit about yourself.
Well, I have been with Coosa Valley since July of last year as the program director.
What does that entail? What does a program director entail?
The operational piece of it, making sure the daily operations go as planned.
Okay. Quincy, last time we talked about wound care, what has been added since the last time we've talked?
A little bit more time and experience. Plan for the future is we're looking at a hyperbaric oxygen chamber, which is considered adjunctive therapy based on Medicare guidelines. They talk about it's an adjunctive therapy for patients who have been, we've reasonably used all the other options to heal their wound, and those things have failed, and so we're having this additional option that's added there that has shown a lot of success. HBO is not a new science. It's been around since the late 50s actually, and it would be similar to diving underwater. The increased pressure that you feel when you go up underwater, if you go into a HBO chamber, you have that same feeling of how a diver might feel when they are going up under the water. But what that's doing, as it increases the pressures inside your body, it also increases our ability to add oxygen to your wound that you don't get at normal atmospheric pressure. So in theory with that, your wound needs that oxygen to heal because those cells are trying to rebuild, and hyperbaric oxygen therapy gives an additional piece to that so that we might have a better success rate in healing some of those more difficult wounds to heal.
So how long have you been doing this?
I've been doing wound care for a little over 5 years now.
Explain wound care. What are we talking about here?
Okay. Well, you know, simply stated, a wound is just an opening or a sore in the skin that we weren't born with. That's the best way for me to describe it. If it's there and we weren't born with it, we're not supposed to have it. These can be either man-made or they can be accidentally made when we fall or when we bump ourselves against something, or if we have a car accident. You know, sometimes these wounds can start out as a blister, but wounds can have problems with healing, and not all wounds after they occur just go through all those phases of healing like they should, and they heal like they're supposed to. So wound care's role in that is to sort of look for that why. Did your wound not heal like it was supposed to, or why is it not healing like it's supposed to? And our job is to sort of be like a private investigator that you have hired. You got a wound and you hire me to look into the reasons why your wound might not be healing the way it's supposed to, so that we can help that get healed for you, because these wounds can be a daily problem for people and can cause a lot of issues, especially if it's a big wound or it drains a lot or it hurts a lot, and they need that wound care perspective to bring in some science and some knowledge about things that we found out in the medical community that can help a wound to heal.
Yeah. Bethany, I guess wounds can affect different age groups different ways, I guess, right?
Yes, sir. We see patients anywhere between 13 to on up in age,
Yeah.
80s and 90s.
Yeah. What's some of the more common wounds that you guys deal with?
Diabetic wounds is right up there.
Yeah.
Diabetic wounds are special because sugar in the blood has an effect on the immune system, which can in turn kind of shut down our body's ability to clean up a wound normally the way it needs to be, and promote that healing process. And so when we have diabetics come in, the biggest thing that you see with them typically is a condition called neuropathy, where you lose sensation in either it can be upper or lower limbs, but we see it in the lower legs more often than we do anywhere. But you lose sensation, and that's your body's natural way of telling you whenever you're wearing a shoe that's hurting your foot, or you get a rock in your shoe, or you bump your toe on the bathroom door. Those mechanisms that tell you those things.
You've been in my house, haven't you?
But once that happens, one of the things we do with that is we try to do a lot of teaching around how it's important that if you can't feel your feet, you have to protect your feet. You have to look at your feet every day. You have to make sure you provide great hygiene for your feet, and that includes things like making sure you put good moisturizers on your feet and your legs, because that improves your skin's ability to withstand those normal daily things that occur when we walk and when we sweat and so forth. So a lot of education in that. Diabetes is just one of them. We see, of course, we see some trauma wounds as well. See a lot of just infected wounds. Trauma wounds are bad about getting infected because whatever you cut yourself on, or the germs that we just normally find in the environment, they're sneaky little critters, and they can crawl right into a wound, and that wound gets infected, and it's not going to heal in the same amount of time it would have had it been clean. It would have healed much faster. Granted, everything else is working properly in the body. That wound should heal in less time without an infection. An infection not only causes increased pain, but it causes increased drainage, can cause unsightly odors that makes the person not want to go out in public because they don't want people smelling their wound because it has a smell to it. So, then of course infections, so then you can look at, there's other issues like blood flow problems. That can be either an artery flow into the leg or a venous flow going out of the leg. But basically with that, the wound bed is not getting enough oxygen to it to heal. So we have to do some back treating of some other medical conditions in order to bring that wound to a point of closure.
Bethany, where is the actual location of our wound care department here at Coosa Valley? Is it on site there?
It is. It's right across the street from the hospital on Anniston Avenue.
Okay. And how do people go about making appointments for you guys?
They can call the center. Our number is 256-872-7777.
Okay.
And we can get you set up.
All right, is there social media sites that they can go to find out more as well?
We do have a Facebook page
Okay, all right.
as well.
Quincy, you talked about several different things as far as wound care is concerned. Is it happening more with older Americans than younger Americans? And what part of the body does it happen more frequently?
I don't think wounds happen more with different age populations because the younger generation, of course, is they're active sports.
They heal quicker, don't they? Younger.
They do heal faster in general, and so you don't end up seeing quite as many young folks in wound care because of that. But we do see our fair share of children and young adults and teenagers in the wound center as well. But in the older population, the wounds are a little bit less trauma and a little bit more disease-related problems that are causing them to have wounds. And of course, all of our body processes slow down as we age, and so in general, it takes somebody that's elderly a longer time to heal than it would a 10-year-old. Mm-hmm. So yes, there is a variation, but I don't know that there's more or less wounds in one age group. I think it's more of a different type of wound in a lot of cases.
Yeah. So, what is your position with the wound care division here in Sylacauga, Coosa Valley?
I am the wound care provider, so I am the local wound care expert that develops the plans of care for the patient after I see the patient. I also provide the bedside component of patient assessment, looking into the why they have the wound, figuring out what other resources that they need, because wounds are not a one-person task. It takes a team of people to heal the wound, because if you don't cover every known aspect of healing a wound down to what are you putting on the wound as a dressing, how often does that wound dressing need to be changed, does the patient need to be getting in the bathtub or their shower with that open wound that they have, do they need to go see a vascular specialist because we think they may have blood flow problems in their legs, do they need initial laboratory test, or do they need radiology tests to help us identify potential diseases that might be going on that is directly affecting this wound? And nutrition is a very, very important aspect of wound care. We push out nutritional support to our patients. We tell them, we try to assess, tell me what you're eating on a general daily basis, and we kind of look to make sure they're getting enough protein, enough vitamins and minerals, and making sure that those things in their dietary are lining up with a good, healthy, healing wound bed. So do all those things, and then of course we keep very concise records of what we do from week to week to make sure that that patient's wound, we know what we've already done, what we need to do we need to relook at something. So it's a continual coordinating process with other disciplines. I mean, the disciplines can range from dermatology to podiatry to cardiology. In a rare case, pulmonology might need involvement in a wound care patient. Nutritionist or a dietitian, sometimes we involve them. Home care is very frequently utilized because of their expertise in doing dressings on patients out in the field, especially ones that are unable to dress the wound themselves. They may need help with that. And so home care, and then of course we use some infusion services for if we have to do more strong antibiotics than what we would just order them, say, over at the local pharmacy.
Mm-hmm. So, Coosa Valley Medical Center, I don't know about other hospitals or facilities, but we're blessed to have our wound care clinic here. And how many people work in this particular area?
It's a relatively tight unit. We have 2 registered nurses on staff every day, and we have a patient navigator up front that's wonderful and gets everybody where they need to go, gets their appointment scheduled for us. gets them to the, to the room safely and all that, and then the registered nurses do the initial assessments of the patients and remove their dressings and assess the wound. And then once they get all of their vital signs and all that together, then they prompt me to come see the patient, and then I order what needs to be ordered. And then of course we've got Bethany that we talked about at the beginning that's there to kind of help the flow of the center to be as effective as it possibly can.
Bethany, does it have to be a primary physician that send the patient to you guys, or can they just contact y'all, or how does that work?
We do both. They do not have to have a referral, but we do accept referrals from their primary, and we work closely with their primary and send them back to them.
We talked about, in general, about wound care, and we've been in depth some, but from what I gather, this could be very, very serious if not treated properly.
That's correct. One of the things, especially with more severe wounds, that I usually, I like to be very straightforward with my clients and my patients, let them know that this is the best case scenario, this is the worst case scenario, and sometimes the first day I see a patient, you may not be able to give them an absolute outcome. But what you can tell them is that with wounds of similar type that I've seen in the past, based on my opinion, this is what we may see, but wounds can cause anything from decreased ability to provide activities of daily living. Patient may have struggles doing their normal daily tasks. Could also create financial difficulties if they're not able to go to work. Right. And if a wound gets infected, it's going to get worse instead of better. So that's one thing we look at. So we're constantly looking at, is the wound infected or not? The other thing that can happen is if the wound gets large enough and deep enough, we can start getting into deeper structures in the body that can result in infection getting into the bloodstream, and the patient could end up missing a lot more work and could end up in the hospital. That's not always preventable, but at least 90% of the time, if you get good care for your wound, we should at least be able to keep you to the point where you're not sick with the wound and having to be in an inpatient hospital bed.
So, a telltale sign that someone with a wound needs to have it checked out by you guys.
The wound has been there for more than 2 weeks and you don't see much signs of healing in that wound, or if that wound has gotten larger, or that wound you woke up this morning and that wound is hurting you a lot more, if you have a lot of swelling around the wound site, or you have a lot of difference between pinkness and redness. If you see this very angry red appearance around the wound, that's concerning that it might be getting really infected at that point. Those things, the increased pain, heavy drainage from the wound, and increasing redness around the wounds are those I need to get somebody, and get this seen about, as soon as possible. If you start running fever and you think it's because of your wound, or you're having chills, or you've had loss of appetite and nausea, you need to get somebody pretty fast about it.
Okay. Well, thank you both for coming this morning. And Quincy, to find out more about you guys, what do they need to do?
Well, they can call the center. We're more than glad to tell them about the services that we provide and give them some insight about, you do have a wound, and yes, this is an appropriate place for you to come and let us consult with you and see what we need to do. In some situations, we might send them to their primary care physician or another specialty based on what they're telling us. But we want to help people as much as possible to get to that place of care that they need to be at. Because if you go to the wrong place, sometimes it just sort of delays getting what you need. So it's good to get people lined up in the right place. The other thing I can do is go on the Coosa Valley website and look at the Facebook if they have it, and look at the Coosa Valley.
That's the gospel
Center.
Facebook, you know.
It is. It is.
I'm sure you guys work with the insurance companies and stuff like that as well, right?
Yes, sir.
Okay. All right. Well, thank you both for coming this morning, and Quincy Leach and Bethany Sis from our wound care center here in Sylacauga, and hope you guys have a great day today. All
Thank
right?
you very much, sir.
We got more Daybreak just ahead. Don't go away.